Hi, welcome to the mental wellness journey. Discover the underlying causes of your physical and emotional symptoms and finally heal. I'm excited today to have Dr. Evan Hirsch with us. He is an expert in fatigue, and he's going to have a lot of information and experience to share with us. Dr. Evan, he's a best-selling author of Fix Your Fatigue, the four-step process to resolving fatigue, achieving abundant energy, and reclaiming your life. And one of the nation's and he's one of the nation's leaders on finding the root causes of fatigue and resolving them. He suffered with fatigue for 5 years before he achieved resolution using the Fix Your Fatigue program that he developed in his medical practice. He has helped thousands of people optimize their energy and is on a mission to help 1 million more through his online program and the training of providers. He mainly works with health-conscious, mission-driven high achievers and works remotely so he can support people around the world. He has lectured nationally and internationally on topics in integrative and functional medicine and is board certified in family medicine and integrative medicine. When he's not at the office, you can find him singing musicals, playing basketball, traveling, dancing hip hop, and spending time with his wife and daughter. So thank you so much for being here. I'm going to jump right in and ask you about your own experience with fatigue, because I think so many of us get into this field, integrative medicine, functional medicine, because of our own health journeys. So can you tell us a little bit about yours?
Absolutely. And thank you so much for having me on, Lori. So when I came out of medical school, I went into residency. I met my wife about a month in, and unfortunately, she was vibrant. She was amazing. We fell in love. And about 3 months later, she couldn't get out of bed. So she crashed hard with fatigue. And so here I am. Studying to be a doctor. I'm going through my family medicine residency, and I start asking all of my professors, all of my attending physicians about fatigue and what's available. I'm reading in Harrison's, all these different things that I'm trying to do to help her. And there really wasn't much help. There's a few things that we look at in allopathic medicine, and we kind of ruled those out. And then
I'm going to interrupt real quick. When you said Harrison's, Harrison's is allopathic physicians' pathology textbook. Is that correct? Okay,
yes.
So if you mentioned Harrison's, people are going to go, what's that? So
yeah,
just before they start looking for it. Sorry.
Thank you. Yeah, internal medicine textbook. It's really huge, and it's really an amazing resource. But unfortunately, there really wasn't much available on fatigue. In allopathic medicine, we're looking at thyroid, we're looking at different diseases, lung diseases, hepatitis, obstructive airways. There's a number of things, but not the most common things, and they're usually outliers. And so we're looking for help for my wife, and unfortunately, it took like 3 years for her to get back up on her feet. And then we got married, and then I graduated from residency, opened my practice, had a child, and then a couple years later, I got fatigue, and I got it for 5 years. And at that point, I was running a big clinic. I had 4,000 square feet. I had up to 10 employees at one point, and I could barely stay awake during the day. And my brain fog was so bad, I couldn't remember the people who were sitting in front of me. Thank goodness I had an electronic medical record. And so,
wow.
So I was really struggling. I could only work for a couple hours a day, so I had to keep hiring practitioners and training them in order to be able to, go home and rest, or sleep in my office under my desk. All those challenging things. And then for me, it was really at that point about survival. And I felt completely powerless when I couldn't take care of my wife. And here I was again, lots of guilt and lots of shame around being able to provide for my family, not being able to help out at home. So I was really struggling. And so I kind of went on this mission of finding all of the causes, because I knew if I found all of the causes, that then all I had to do was find the right treatments and I could resolve it. And so I went, I started in conventional medicine, and then I went to holistic and integrative medicine, which is combining natural medicine plus conventional medicine. And then I went into functional medicine, which is really looking at the biochemical individuality of people, and individual cells and what the biochemistry looks like. And then I went into environmental medicine, which really taught me a lot about the toxicities that are in our environment, like heavy metals and chemicals and molds. And then I did specific trainings in infections. And so as I went through this process, with every single step that I took, I would apply it to myself and I would get a little bit better. I would apply it to my patients. They would get a little bit better, and then we'd plateau. And then I'd learn something new. I would check and see who had that cause. I'd apply that treatment to them. Then we would all get a little bit better. And what I found was that there are 15 different causes of fatigue, and I had all of them. And that's one of the
At least you do everything
right.
fully.
Right. So,
Wow.
and so I went through that process, and my energy went from a 2 out of 10, with 10 being ideal, up to a 9 out of 10, and so now I feel incredibly blessed. I have the life that I want. I've got the business that I want, and I'm on a mission to help 1 million people get to that same place. So thanks for
Would
letting me share my mission.
Yeah, absolutely. Because uh, so often I see people that get referred to me because their doctors say they must be anxious or depressed because what they have, they can't solve. And,
Mhm.
I interview them and yeah, they're anxious and depressed, but mainly it's because they know they have these physical symptoms that nobody's helping them with. And it's
Right.
antidepressants and anti-anxiety help a little bit, not very much.
Right.
So, that's why you're perfect for this online video series. Fatigue, how does somebody know they have fatigue versus just being a little bit tired versus being sleep deprived or being
That,
depressed?
that's a great question, because as humans, we're so able to adapt, and we get used to things, and we think, oh, it's just because I'm getting old. But if you're sleeping for 7 to 9 hours a night, and you're still tired during the day, or you're surviving on coffee during the day, or 5-hour energy drinks during the day, not feeling your best, then there's a problem. And sometimes, yes, if you are climbing Mount Everest, or going out all night on the weekends, it's going to take you some time to recover. But if you're getting 7 to 9 hours a night, it should only take a couple of weeks, and then you should be back where you're at. But if you're not, then you're fatigued and something needs to be done about it. You don't have to wait for 6 months for some of this criteria about chronic fatigue to kick in before you get treated. You need to get started. The body's going to tell you when something's wrong, and you need to just listen, and you need to get started right away.
Can you just highlight that? Tell me about 6 months in chronic fatigue, or tell our audience about that.
Yeah, so the Centers for Disease Control in Atlanta and the Institute of Medicine, and all these people who are kind of coming out with these different descriptors about how to diagnose fatigue. And most of the time, they're talking about chronic fatigue syndrome, not just fatigue, or not just chronic fatigue, which basically means fatigue that's lasting. Because normally, if you have acute fatigue, basically you stay up all night and the next day you have to sleep. Right? But chronic fatigue is if you're getting good sleep and it's just lasting for a long time. And then chronic fatigue syndrome has certain criteria. And so with these organizations, they're saying that you can have chronic fatigue syndrome if you have had a number of these symptoms for 6 months or longer. And what I'm saying is that as soon as you know that something's wrong, you listen to your body. You don't wait until it's screaming at you to do something about it.
Right. Okay, that makes a lot of sense. So what do you do? So people, do you go to your doctor right away, or do they come see you, or what should people do if they realize they have fatigue?
So the first thing I think with anything, and I preach this all the time, is you have to find the cause,
Mhm.
right? If you take your car to the mechanic, what are they going to do? They're going to diagnose your car, right? They're going to figure out what's wrong with it, right? If you're a business owner and you've got an HR issue at work, you want to find out what the problem is, right? And then you want to fix it. Because if you don't know what the problem is, you can't fix it. So whether or not, however you can always start by seeing a local doc, but that's also a big challenge, because fatigue is so complex
Mhm.
that, the reason why conventional docs natural docs, even sometimes integrative and functional medicine docs are not having successes because they're not addressing all the causes. Because like we're going to talk about in a minute, like I've found that the causes can be broken up into deficiencies and toxicities, and a lot of these docs, including functional docs, who are awesome, are focused on the deficiencies, and sometimes they're focused on one of the toxicities, but generally not all of the toxicities. Okay, so that's kind of the challenge with finding somebody locally. But you do have to find all of the causes, so that's always the place to start. And we can dive into what those causes are
Yeah.
to make people more aware, if that
I'm going to
helps.
start with the deficiencies because I think that makes a lot of sense because we're definitely overfed and undernourished. So as a society, which I keep saying over and over. But so, yeah,
Absolutely.
so how do you, so if somebody comes to you or I come to you and I, say I have this fatigue, what would you do? What kind of deficiencies would you look for?
Yep. So I've got a 4-step program.
Okay.
First step is to assess all of the causes. And part of that is looking at the deficiencies and the toxicities. So deficiencies are looking at things that are supposed to be in the body that aren't there. And so we're looking at deficiencies in hormones, like adrenal hormones, thyroid, sex hormones. We're looking for deficiencies in nutrients, like vitamins and minerals, vitamin B12, magnesium, iron, etc. And then we're looking at deficiencies oftentimes in good lifestyle habits. So not enough sleep, not enough water, not enough good food. So if we're eating a lot of food, toxic food, because food can be good for us or it can be toxic for us.
Mhm.
Um, and then deficiencies in immune tolerance. So the immune system is a big part of this because oftentimes when I see people, a lot of times they're sensitive to certain things. They're sensitive to foods, they're sensitive to inhalants, and that's because the immune system gets triggered by the toxicities that we're going to talk about in a second, and it doesn't have the tolerance of its normal natural environment, and so then it starts reacting to everything and causing inflammation. So I put that in as a deficiency of immune tolerance. So basically your tolerance to your environment.
Okay.
And then in the toxicities, we're looking at heavy metals,
Hmm.
chemicals, molds, infections, allergies, which can be to foods or inhaled allergies, negative emotions, or basically emotional barriers to health or patterns that you've kind of been stuck in through different things that have happened in your life, and then electromagnetic frequencies. And so those are the toxicities, those things that are in the body that shouldn't be in the body that we need to get out of the body. And interestingly enough, the toxicities actually cause the deficiencies. So those deficiencies in hormones and nutrients and whatnot, sometimes there's a genetic component,
Hmm.
but it's only about 10 or 20%. And the rest of it is all about these toxicities that end up causing problems with the deficiency. Oh, and I forgot mitochondrial dysfunction in the
Oh,
deficiencies.
you can't
Can't
forget that.
can't forget mitochondrial dysfunction. Mitochondria is responsible for producing about 70% of our energy. It's found in every single cell in the body except for red blood cells. Very important. And it gets squashed by the toxicities. And so you have to remove the toxicities, but then you also have to inject the mitochondria with some good love to bring it back online.
So if you just replace the deficiencies and you still have the toxicity, it's just going to get into a cycle. So where do you start?
Exactly. So, and that's where people plateau, and that's
Okay.
oftentimes where they're seeing the natural, the conventional, the integrative, and the functional docs who are generalists, and they're replacing all those deficiencies. And yeah, you'll get better if you're optimizing all of those things, but you're going to plateau. Let's say your energy is a 2 out of 10, with 10 being ideal. You may get up to 3, 4, maybe 5, but then you plateau you
Okay.
know and that's because those are band-aids. They're helpful, but they are band-aids. And in my process, that is actually the second step that I do. So if we can jump into the 4-step process
Yeah,
that
but
I
I want
like to
to
take
interrupt you
people
just
through.
for a
Yeah.
second. What happens when I go to the doctor, and this happens as a physician? I get people who go, "Oh, they said all my lab work was fine."
Uh-huh.
Um, what but when I see them, I'm looking and going, their lab work isn't fine, and I don't know if everybody understands that because I
Yeah.
know you look for the optimal range.
Absolutely. Yeah. So there's a couple things that are happening at that point. If they go to the doctor and the doctor says, your lab work is fine, either they're not interpreting it correctly, because in essence, the reference range that the lab is telling us is not an optimal range. They basically take everybody who's ever done the test, the population that's done the test, they create a bell curve, they chop off the top and bottom fifth percentiles, and they call that normal. And that's not normal. And so we're looking at optimal, which oftentimes is in the top third of the range or the bottom third of the range, or it might not even be in the range. So we have to be very careful about that. So that's one of the reasons why, is that they're not interpreting it correctly. The other thing is, if a physician says or provider says, hey, I don't know why, it's because they're not doing the right testing. They say there's no cause for your fatigue or there's nothing wrong with you. It's just because they haven't done the right testing. But when you do the right testing, you're going to find those things that are wrong with somebody, and then you can fix them.
And that's key. You have to
That's
do the
super
right
key.
test, look at the right, interpret them correctly, and then fix them. Yeah.
Absolutely.
So thank you, because I think that's an important clarification. So you get people, and then all of a sudden they're plateauing
Right.
after you give them some replenishment.
Right. So my 4-step process, we start off with step 1 to assess all of the causes, all the deficiencies, all the toxicities. And then we go into step 2, which is replacing the deficiencies. And the reason why we do that, even though we just talked about these being band-aids, is because the fastest way to get stronger, faster, is to replace those deficiencies. And you have to replace those deficiencies in order to remove the toxicities, because removing toxicities is very hard on the body. And you have to be strong enough in order to go through those processes. The other thing is that replacing the deficiencies makes everything better, makes your detoxification pathways better, makes everything work better. And so that in turn is going to help out with step 3 and step 4. Now, and I should say that this 4-step process really is all about step 4. And so we're kind of priming throughout this process in order to get rid of the toxicities that are in step 4.
But you're getting a little bit incrementally better along the path.
Exactly. Yeah. Because I mean, the nobody likes going to see a practitioner and the practitioner saying, "Hey, I'm going to get you better, but it's going to take 12 months."
Yeah.
You're not going to feel better until you get to 12 months, right? So if I can say, okay, every single month you're going to feel an uptick in your energy and you're going to keep getting better, people like that a lot better than having to wait all that time. Plus, also, if you just went at the toxicities right away, it wouldn't be pretty, because you have to have step 3, which is opening up the detoxification pathways. You have to have step 2, which is making sure all those hormones and nutrients have been replaced. So, yeah. So step 2, replace. Step 3, open up detoxification pathways, which is essentially everybody that I see has clogged detoxification pathways because of the toxicities.
Okay.
So all those heavy metals, chemicals, molds, and infection, they all clog the detoxification pathways. And that's detoxification out of the bowels. So
Okay.
making sure you've got good bowel movements during the day. Detoxification out of the liver and the kidney, which are essentially our filters. So our filters are getting clogged. So we have to open those up. And then our lymph system, which is basically our garbage system of the body, which exists in the body and in the brain. And so I think of the body as like this big tube, and we're kind of like dumping things into it. And so if we want to dump things out of the brain, we dump it into the lymph system in the body. And if it's not clogged, then things will continue to flow down into the liver, down into the kidney, down out of the bowel and the urine in order to get things out of the body. But if you have any clogs along the way, then you can't get things out. You end up getting buildup and you feel worse.
And how do you detect if there's a clog, and what do you do to unclog? Yeah.
So I assume that everybody is clogged, because that's been my experience. And then I'll use
Otherwise, they
certain.
wouldn't be feeling bad.
Exactly. Exactly. And then I'll use a number of herbal combination products in order to open up each step of these pathways for bowel movements. My favorite thing is actually magnesium, using magnesium as a laxative, Just magnesium has so many wonderful benefits in the body, 550 different enzymatic reactions that it's responsible for. And so if we can increase your magnesium in any way, and it just so happens that it's going to have the added benefit of giving you that laxative effect, so you can have a bowel movement twice a day, that's perfect.
Is it all magnesium, or how? I mean, you know, 10 years ago when I would go and somebody'd say, go look at magnesium, and I'd be like, there's all these different kinds.
That's
Um,
a great point.
what?
So it is all magnesium,
Mhm.
but with some magnesiums, they have more of a laxative effect than others.
Okay.
So if you're looking at citrate, that's the one that's going to have magnesium citrate is going to have the most amount of a laxative effect. And then oxalates and some of these other ones will also have a little bit of a laxative effect. And then there's the chelates,
Mhm.
which is the best absorbed, but still, if you increase those to the nth degree, you're going to get a laxative effect for them. So it depends on what you're using them for. You know, if somebody's got contracted muscles, muscle pain, and I want to use magnesium since it's an amazing muscle relaxer, I'm
Mhm.
going to use more of the chelated form because I want that absorbed into the muscles instead of causing the musculature of the intestines to relax so that somebody can have a bowel movement and move things through. But if I'm just looking for the laxative effect, then I'm going to look for something that's got more of the citrates in it.
Okay. Great.
Great question. So detoxification. So yeah, so then I'll use herbal complexes, whether it's milk thistle. Um, I don't even remember the names of them anymore because I have these products that I
Right.
really like that are combinations. I
Sure.
really like sarsaparilla or smilax. You know, so I'm using a number of these things that I have specific products for kidney, for liver, for lymph, and for neurolymph or brain lymph as well.
And how long does it take to unclog the detox pathways?
So it really depends. I generally tell people that it'll take about 1 to 3 months per step in this process.
Okay.
So depending on who the individual is and how long it takes, and yeah, and a number of other factors. You know, if somebody's still living in mold, you know, if somebody has emotional stuff that they're not willing to work on, you know, so that's generally, so usually it's going to take you, you know, a month to kind of work up to the doses that I want on these products. And
Mhm.
then it'll take another, you know, 3 to 6 months because you're going to take it with the products you're going to use in order to remove the toxicities out of the products. You want because you want to make sure those detoxification pathways are open and patent while you are binding some of these toxicities that are hiding in different parts of the body. You're pulling them out, and then you want to make sure that they're moving through appropriately.
And how do you discover which toxicities are there? And how did you discover you had all of them?
So what I've found too, and what I preach in my programs, is that 75% of all of these causes can be determined by symptoms.
Mhm.
So I take people through some of these big questionnaires to determine exactly what causes they have. And then they are supported, complemented with the labs. Now, for the toxicities work a little bit differently because most of the time you really need the labs for them because they can look very similar. So heavy metal toxicities like mercury and lead, chemical toxicities like pesticides, herbicides, and plastics. Um, Molds. Oftentimes they can really look and even the infections can look very similar because they're causing neuropathies, they're causing cognitive issues, you know, brain fog, numbness and tingling in the fingers, in addition to the fatigue. So those symptoms can look very similar. So to assess those, I always like to provoke. And most of the time with a lot of these, I'm using urine samples.
Oh, that's not bad. But what
Right.
do you mean by provoke?
Yep. So most of the time, these toxicities are hidden in different parts of the body. So they're hidden in our tissues, in our organs. They're not just floating around in the bloodstream. If you did a blood test, you're not going to find them. So you have to pull them out in some way. So for heavy metals, we want to use a chelating agent that's
Mhm.
going to, chelate is Latin for claw, which means to bind. And so you're basically binding the heavy metals, pulling them out into the bloodstream, and then collecting them in the urine for the next 6 hours. If you're doing mold, you want to do the same thing. Essentially, you're pushing them out with a provoking agent into the bloodstream, and then out into the urine. Same thing with the chemicals, and then with the infections as well. A lot of infections live in the lymph system, so you want to get a good lymph massage before you do this urine test, or you want to exercise intensely for 30 minutes, which most of my patients and clients cannot do. So oftentimes they're getting the lymph massage, and then they collect the urine. And we try to look for direct measurements. So there are some people who will recommend that when you're looking for mold, that you look for the immune system's response to mold. That's
Mhm.
considered an indirect measurement. What I'm talking about is looking for mold toxins that are going to be in the urine that cannot be mistaken for anything else. Because if the immune system is reacting to mold, it could be that increase in immune system reactivity can be due to any of these toxicities that I'm talking about. Most of the time, it's not going to be specific to mold. Okay, so I'm looking for direct measurements, essentially like looking at the DNA of these particular things. With molds, we're looking at mold toxins. With heavy metals, we're looking at the heavy metals. With the infections, we're looking at the PCR test for infection. So the DNA for the infection is going to show up in this urine test.
And
So
is
then I'm
that,
not looking at the immune system's reaction to the bug.
and is that where they say like tests for Lyme and co-infections are hard to detect if it's in there? And so you have a
Exactly.
different way of looking, or is that the
Exactly.
PCR test? Okay.
Yep. So yeah. So the reason why they say that even the Centers for Disease Control in Atlanta says that the Western blot test or the serology test or looking at the immune system's reaction to the bugs is really for epidemiologic studies only. It's for research. It's not for diagnosis and definitely not for treatment. And
Right.
this is because you need an intact immune system in order to be able to assess a test where you're looking at the immune system. Now, if you've got heavy metals, chemicals, molds, and infections, and any of these deficiencies, guess what? Immune system's off in left field. You're not going to get a good reaction on that test. And so it's just not very accurate. So yes, whenever possible, I always want to look for a DNA test or looking specifically at the item we're testing and provoking it to kind of push it out of the body.
Okay. And maybe you already said, and I'm one of the audience as well. So you're looking for what toxins are there to get rid of them, but you also said kind of the immune system is not working well. So you also, did you say you also support the immune system? I'm sure you said it in there.
Yeah, well, I was talking about in terms of looking at immune tolerance.
Okay.
So
Yes.
part of what happens here is, yes, definitely you want to support the immune system, but part of the problem too is that the immune system is stuck in an inflammatory position. So it's basically like leaving the light on all the time. And you've got this really angry immune system that's attacking everything. Because at its most basic understanding, the immune system is there to get rid of things in the body that aren't supposed to be there. So anything that's in the body that's not supposed to be there, the immune system reacts to it. It calls for its friend, hey, come help me. Here comes the immune system. They all gang around this thing. They remove it out of the body. Well, guess what happens if they can't remove it out of the body, or if it's stuck behind a wall? Let's say it's in the cells of something. Let's say it's in the thyroid. They have to go through the thyroid in order to get at this thing. And in the process, they're damaging the thyroid. They're
Okay.
breaking up the thyroid. They're causing Hashimoto's. They're causing Graves, whatever it is, to get at what they're trying to remove. Now, if you remove that thing, then all of a sudden the immune system is like, oh, it's not here anymore. I don't have to react to it. So I really hesitate. I don't use a lot of stuff to boost the immune system. Most of the times I'm going to use, vitamin D. I'll use some other things in order to decrease inflammation and in order to stabilize the immune system. But I really shy away from some of these herbs that are really modulating Th1 and Th2 because I think we don't really know, which are different aspects of the immune system, because I think we don't really know enough about what we're doing, because we can really be increasing inflammation by doing it. If we're boosting Th1 and Th1 is actually what's reacting to something and causing the inflammation, then guess what? We're just boosting inflammation.
Yeah.
and
Okay.
increasing pain and dysfunction in the body. But then improving in the immune tolerance that we talked about, we do want to change the immune system's reactivity to these things, because sometimes it's because there's this toxicity there, and sometimes it's because the immune system gets confused and it thinks that this thing is toxic and it's not supposed to be. Like, let's say infections. Most of the infections that I see that people have, they've had since maybe they were 5, or they got from their mom through the placenta.
Oh, wow.
So sometimes it's from a big inoculation, like a tick, giving you a whole bunch of Lyme.
Mhm.
But oftentimes it's just from something that they got from mom, that they've had several stressful things happen in their life. Maybe they got some other toxicities, and then all of a sudden the bugs are out of balance.
Mhm.
So part of this whole process, we're removing the crap. But then even if you remove the crap, the immune system can still be inflamed. And that's where we have to change its relationship to those things. So change its relationship to foods, change its relationship to inhaled things like molds and mites and animal dander, change its relationship to these infections. And because then that's going to bring down, it's going to create more of a tolerance, more of an acceptance, more of a friendship. Because really, we've got 90% of all the cells in our body are bug cells, 10% are human cells. Like, we've got this beautiful relationship with these infections that just goes fakakta. It just gets messed up, right? And
Yeah.
so we have to bring that back into balance. And that's when I use something called low dose immunotherapy, which has been really revolutionary for my practice.
Oh, that's a whole nother
It's a whole nother ball
multi-colored.
of wax, and we can
Yeah,
get
that's
into it if you want,
great.
but it's, yeah.
Yeah. Um, you mentioned emotions. So, as a potential cause or kind of bad emotions that get stuck, how do you how do you see that? How do you
Great
determine
question.
it's that versus an infection?
Yep.
And I know it can
S-
be both, obviously, but
Right. Well, and it's always what I tell people is that everybody's got multiple causes of infection or of fatigue, and everybody's got different causes of fatigue. So, you might have 1, 3, 5, 7, 9, and I might have 2, 4, 6, and 8, right? And so we always want to leave no stone unturned. So we always make sure to evaluate the emotions as well. And so the way that I do this, and I evaluate it in everybody. And so it's taking an ACEs test. So looking at adverse childhood events. So there's certain things that can happen in your past, which can be abuse, but it can also be like rejected by a peer group, which is something that I had that was challenging for me, or being intimidated by a sibling or something like that. So there's a number of things that we need to look at, that we need to examine, that change the way that we look at the world. Is the world a safe place? Is it not a safe place? What do we actually believe? Because our beliefs dictate our life, and our beliefs dictate our actions and how we relate to life. So that's one of the things that I look at. And then I'll use different practitioners in order to help out with that. I really like NARM. It's something that my wife is trained in, which is a neuro-relational model that doesn't go into the past, but instead helps people who've had all sorts of different trauma move on into the future by asking really good questions. So that's one of the things that I recommend.
what is
um,
NARS? Can you I'm not familiar with that at all. Can you
sure.
tell me?
NARM.
Okay, and what is that?
And it's I'm gonna totally
Sorry.
goof it. It's neuroaffective relational model, I believe.
Okay.
Um, and my wife, this is kind of what she practices,
Uh-huh.
and so there's I've just seen a lot of good stuff. I've done it myself, and I've seen it really help my energy as well. So that's one of the things, and a lot of this stuff is really about retraining the limbic system. So if you're looking at the brain, the limbic system is responsible for emotion and memory, where oftentimes they get caught up in each other. And so when we experience, like, let's say a dog is coming at you down the street. If you have a relationship with dogs that has been good your entire life, you can be like, oh, there's a dog, and you might want to go and pet it. But if you have anything along that line that dictated to you that dogs are not safe, that's going to inform that next decision. And our body is constantly doing that 1,000 times a second to assess whether or not we're safe, because inherently we are animals, and it's all about survival. and safety. So the limbic system is something that will get caught up and confused and start reacting and causing inflammation and all this sort of stuff. So resetting it with something like NARM, or with something like Annie Hopper's DNRS program, the Dynamic Neural Retraining System, or Dr. Gupta's Gupta program. These are some of those ways where people can retrain their brain on how they should interact with the world in a more positive way. And so those have been really powerful that I've seen, and I've spoken with other practitioners who have felt the same.
Yeah, I totally agree with you. I just wasn't familiar with that particular one. And I mentioned earlier, neuroquant is that brain imaging where you can see the limbic system inflamed, and you can
Wow.
predict who's going to do well with that. And I like it because a lot of people go, they feel like therapy is something they have to go back and look at their childhood for skeletons in the closet.
Mhm.
And this kind of therapy is not like that at all. And I've seen it successful time and time again. So there are variations of that, and you got to find one that resonates with you. And I think that's awesome. And
Absolutely.
then you don't have to go, for years and years of therapy. It's a time limited, um, very here and now training program. That's just another way into the brain, which I think, is excellent.
Right.
It's great.
Well, and so much of this too is all about, what your daily practice is. How do you retrain your life so that you're going to be successful? I do in my programs, I talk about your daily mindset practice, where we go through gratitudes, envisioning, and empowering beliefs, to really get your, because there's something called neuroplasticity, where you can retrain your brain to think a certain way, to be a certain way, which is going to change your life. So there's a lot of these tricks that can be really helpful.
Yeah, exactly. And I think people underestimate the inner dialogue. A lot of people, at least in my practice, coming from the
Mhm.
psychiatry world, have, and how it just is so automatic. And it's just a constant chatter, and they're um, not helping their mindset at all. So I
Right.
love that go.
Well, and that's really what I found. I was getting people to a certain level working on the physical stuff because I really didn't want to go into my emotional stuff. And then Stacy's encouraged me to go into mine. I go into mine and I see great stuff. And then I start incorporating that into my clients. And then there's experiencing really significant improvements in their energy. So once again, another cause that you're plateaued, and you have to incorporate the emotional. Oftentimes, if there's an energetic block, working with acupuncture or some energy healers can be supportive. So you always want to approach these things, multiple layers, multiple causes, to make sure there's no stone unturned. Because if you are plateauing, it just means you haven't found the next cause that you need to in order to get to the next level.
Yeah, no, I think that's really profound. What are, besides fatigue, what are common symptoms that go along with any of the toxicities?
So oftentimes there can be, so it really depends on the toxicity. So, neuropathies are quite
Yes.
common. So numbness and tingling in the hands and feet, or shooting pains throughout the body. There can be cognitive issues, so brain fog, memory issues. Some of the most interesting ones that I'll say are with the infections. And
Okay.
with the infections, kind of coming back a little bit to diagnosis and figuring out which infections you have, is that, and even according to the Centers for Disease Control, most of these are clinical diagnoses. So you can actually determine with relative certainty what infection you may have based off of the symptoms that you have. So if we're looking at Borrelia, which is otherwise typically known as Lyme, you cannot have Borrelia if you don't have the following. You have to have either joint pain, muscle pain, or nerve pain that moves around the body and comes and goes. Okay, if you do not have those symptoms, there's really nothing else that causes that. And if you do not have those symptoms, then most likely you do not have Borrelia.
And that's where
Okay,
people come to me and their doctors say they're crazy
right.
because that doesn't meet with anything but how common it is. So, wow.
Yeah. And then And then other infections like Bartonella. Like
Mhm.
Bartonella, oftentimes people are having neck pain, migraines or headaches, muscle pain, typically misdiagnosed as fibromyalgia. They'll have anxiety and depression, which are, huge. The psychiatric stuff that I see in my clinic are, you know, mostly infections and then molds. There's definitely deficiencies on a lot of this stuff that can be helpful: thyroid, adrenals, neurotransmitters. But I really see that I make huge shifts when I'm addressing these infections. So Bartonella, anxiety, depression, insomnia. There'll be pain on the bottom of the feet or in the feet at some point, and sometimes misdiagnosed as plantar fasciitis. They'll
Mm.
have muscle cramps or really tight muscles, or sometimes a feeling of something happening in the muscles. They'll have sometimes stripes on the body that look like um, stretch marks, that are just considered Bartonella striae. And then oftentimes they'll have thyroid issues. And so you don't have to have all those symptoms, but if
Mhm.
you have a couple of those together, then it's very likely that you may have Bartonella. And then Babesia is the biggest one that I think oftentimes the reason why people commit suicide when they have Lyme or Lyme type infections is because they have Babesia, because it's an intracellular organism. It's very similar to malaria. It'll cause day sweats and or night sweats where people will spontaneously sweat and they will be the hottest person in the room.
Mm.
And then they will also have awful sleep. They will have depression to the thought of suicide. They will have, or suicidal thoughts. They will have anxiety to the point of panic attacks. And then they also will have generally some shortness of breath. Sometimes that manifests as a cough or something related to the lungs, but typically shortness of breath. But
That's
that's
the
that's really
air
the big one
hunger.
when it comes to psych stuff.
Is that the air hunger people describe?
Yes, exactly, the air
Okay.
hunger.
Like they can take a breath, but they don't feel like they have it. Now, um, are people treated with anxiety, anti-anxiety and antidepressants, and they actually have babesia or Bartonella or Lyme, and do the medicines work at all? And I'm assuming if they come to you, they haven't been working, but what have you seen?
So, well, and those are band-aids. If somebody needs it for a period of time, like that's what you do. I mean, you're not going to be able to get rid of the infections overnight, oftentimes. Though Babesia, you can get rid of pretty quick, fortunately. But usually what's happening is you're mitigating the effect of the infection on the body. So like I said, the toxicities cause the deficiencies. So the infection, the Babesia, is decreasing the neurotransmitters. And I don't have any proof for this, but this is typically what I
Mhm.
see in my experience, is that it's decreasing the neurotransmitters. And so if you give somebody something to modulate their neurotransmitters, that can be supportive for a period of time. And it's also going to increase the central nervous system activity. And so then if you take something that's a GABA agonist, or basically that's stimulating the central nervous system to be more relaxed, like you're taking Klonopin or Xanax or whatever it is, and an anti-anxiety or anti-panic, then that's going to work on that subsequent sequelae, or that cause, that thing that is being caused by the infection.
Gotcha. But by the time people come to see you, um, they already know that there's probably something else. Because
Right.
too often I see people and they just stop there. And, one of my theories, in addition to some colleagues, is there much more going on underneath, uh,
Right.
which I, wish people had the ability to look further for things, especially with, the intensity of some of the symptoms, which can be quite dramatic.
Right. And
Uh,
people believe oftentimes that it's genetic, or that there's something wrong with them biochemically and they're just going to be predisposed to anxiety and they just have to take this pill. And that's not the case. And what I've seen too is that most of the time genetics are not genetics, it's environment. And it's because certain things are being passed down. People will say, I've got autoimmune thyroid in my family for years. And what I believe is that there's actually a toxicity that is triggering that immune system to attack the thyroid, that gets passed down from placenta into the uterus through the generations. And that's why, and it's, certain things like Bartonella is very specific for the thyroid. And so it's probably something like Bartonella that's being passed down, or these toxicities. And we now know that like heavy metals and chemicals are getting increasingly concentrated as you go through the lineage. And so the mercury that your grandma had is a lot less concentrated than the mercury that you have that got passed down through the generations. So very important for people to realize that you have to keep asking why. And that's what I preach all the time, is that you have to keep asking why, because there's going to be a cause under the cause. What is the reason for this? Okay, you've got anxiety. What's the cause of the anxiety? You've got nutrient deficiencies. You've got neurotransmitter deficiencies. What's the cause of that? And then
Mhm.
what's the cause of that? So if you keep asking those questions, you're going to be led eventually to what you really need to be doing.
What you say is so profound, and I wish, I'm going to cut this little piece of the recording and play it for people, because so many times people are just like, it's my family, and
Right.
when they have to keep changing medicines all the time and they don't want to do anything other than that, it's frustrating. I totally agree with you. Asking why and keep doing it, keep searching and keep searching. Um, So in medical school, in the lectures, we always had so many lectures. We always had the take-home message, and you've provided so much profound information today. So I really, really thank you. What would be your take-home message if people could take one thing away? What would it be?
Great question. So I think that if you're taking one thing away from this, it's all about the causes. No matter what you're looking at, anxiety, depression, fatigue, you've got to find the causes. And so if you're not finding the causes and you don't have a broad enough differential, or basically you're not looking at enough of the causes, you need to keep looking. You need to take a look at the work that you're doing, the work that I'm doing, to find all of the potential causes, to go through each one of those, have them evaluated appropriately so that you can get the data that you need, and then combining your symptoms plus the lab data and putting that together, and then finding the right treatment. Okay. And I tell people, like, if you're dogged in this, if you are committed to getting better, if you're decisive that you are going to get better, and if you're going to be coachable by an expert in the topic, there is no doubt that you are going to get better, because the information is out there and you just have to go for it. You just can't stop. You just keep moving.
Yes, and you got to find the right person who knows all of the causes and not just some of the causes. It's there, and
Absolutely.
it is treatable. And that comes to your free gift. And I know, and we'll make sure everybody gets the URL, but there's a copy of your book available, Fix Your
That's right.
Fatigue. So I don't really urge people to, um, you'll be so helped if you get this book and read it. It's awesome. I just loved what you're saying, and you shared so much information. So thank you so much.
Thanks so much for having me on.
Bye now.